Good day, everyone. On this special evening, we, Group 13, under the subject of moral education, are going to present a topic called Mental Health Crisis During COVID-19 Pandemic. I'll start off with an introduction about what is a mental health crisis. A mental health crisis is any situation in which a person's actions, feelings, and behaviors can lead to them hurting themselves or others, or put them at risk of being unable to care for themselves or function in the community in a healthy manner. Situations that can lead to a mental health crisis can include stress at home, like conflicts with loved ones, exposure to trauma or violence, stress at work or school, and other environmental stress can also contribute to a mental health crisis. Raising awareness is important when it comes to mental health. This is because an average of 29% of adults in Malaysia is dealing with mental disorders without the people knowing. This will further increase the amount of suicide attempts in Malaysia, especially during the pandemic. There are many benefits when an individual pays attention to one's mental health. It simultaneously means that the individual is in contact with their minds in order to maintain a happy and healthy lifestyle. The main objective is to decrease the number of suicide attempts in Malaysia, or better, the whole world. Suicide is never the answer when it comes to solving problems. However, due to desperation and lack of mental health knowledge, one might attempt to kill themselves. That's the key. An individual should never stop learning about their bodies and minds to ensure one is intact with their own bodies. Now, we proceed to the next point, which is how it affects us and the people.
Today I'm going to talk about mental health crisis due to this COVID-19 during this pandemic, how it affects us and how it impacts us. The first thing, difficulty concentrating and making decision, and the second thing is frustration and depression. Because of frustration and depression, people are suicide, and every day in our country suicide cases are increases. The third thing is isolate and lonely, and it's increased stress and anxiety among people, and it causes strong emotion in adults, elderly people, and also children. During this pandemic, there's a lot of things that affect us.
And I'm going to talk about mental health issues and what triggers it. So what is mental health? So mental health is basically a person's condition with regard to their psychological and emotional well-being. Moving on, there are factors that affect mental health and trigger mental health illness. For example, the first one being childhood abuse. People may go through a lot when in their childhood, so that can cause traumas as well, which is another factor which triggers mental health issues. Secondly is experiencing discrimination and stigma. Basically, discrimination can come in many forms, for example, racism. Thirdly, severe and long-term stress. Stress can be personal problems, can be school-wise, it can come in different forms. And in conclusion, this factor is probably one of the most common factors that trigger mental health illness, and this is drug and alcohol abuse. This can cause serious mental health issues.
During this pandemic, a lot of us are in stress, depressed, and many more. We can't even go out without any appropriate papers. And how do we seek help? Relax, guys. We are in modern and technology era. Whatever we want, whatever we need, we can do in our handphones. For an example, we can call our friends and have a conversation and relieve our stress in home. Furthermore, you can also Google about how to relieve our stress, and there are thousands of websites and therapists that you can also book an appointment with them. Moreover, because of this pandemic, some of the people didn't get food properly. So there are a lot of good people who are helping them, such as MSU Bank Heroes. They are distributing food for students and people nearby at Menara U. Therefore, you can also search for an organization who are distributing food around you. As a conclusion from me, I want all of you to be strong both mentally and physically to fight the COVID.
All of us may experience increased feelings of anxiety, powerlessness, impatience, frustrations, or even worry. Focusing on how to actually slow the spread of this virus is really important for our physical health. However, identifying ways to manage our mental is really vital. There are many ways to actually overcome this mental health crisis during pandemics, and certainly I will mention some of the ways so everyone can learn from it. First and foremost, all of us have to take a break from the news and social media. This is because after a certain point, it can be more upsetting rather than informational. Make sure the information that you get is really helpful for you to read in a day. Make time to unwind and remind yourself that these strong feelings will fade away. You can also create a new adapted schedule, taking cancellations into account. Keep things as consistent as possible and focus on what you can control. The most important part is to be kind to yourself and others, whether they are far or even near you. Talk to them during this pandemic season so they would not get caught in this mental health crisis as well. At least you've done your part to make them feel okay.
Conclusion: pandemic not only causes physical health concerns to the people but also result in a number of psychological disorders such as depression. The spread of the new coronavirus can impact the mental health of people in different communities. It is also essential to preserve the mental health of individuals and to develop psychological intervention that can improve the mental health of vulnerable groups during the pandemic. This is why the White Flag campaign is made. The White Flag campaign is made as a symbol of hope and helping each other. And let's all continue to do our part and learn as much as we can to help our fellow citizens. After all, we're still in this together. And in the meantime, do practice self-care and watch over your own mental health.
And that is all from us, Group 13. Be sure to stay safe and reach out for help if you need one.